My name is Taylor Stevens, and I'm an investigative reporter at Fox 13 News. Over the last few months, I've been reporting on Utah's long-term care industry, and we know that choosing a nursing home for yourself or a loved one can be a really consequential decision, and it's one experts say you should do some research before making that choice. So I wanted to quickly show you a tool that can help narrow down that decision and provide some additional information as you're looking for a nursing home. So this is the Center for Medicare and Medicaid's Care Compare tool, and this allows you to look at different types of Medicare providers. So you can look at doctors and clinicians, hospitals, but today we're going to focus on nursing homes, including rehab services. So if you click that on the side there, you can see that you can enter a location, and this just allows you to look at all of the Medicare certified nursing homes in a particular location. So you could enter a zip code, a city, or a state. I'm going to put Utah, just so we can see all of the nursing homes in the state. So once this pulls up, you can see here that we have 97 nursing homes in Utah and can see some information available for all of these different providers. So there's a lot of different ways you can look at this data. You can sort it alphabetically, you can look at the highest rated facilities in the state, you can filter by overall rating, and you'll see that each of these facilities has a star rating, which goes from 1 to 5, with 1 star being much below average, 5 stars being much above average. So we can sort by those. If there is a particular item that's important to you, for example, you want to see the best rated facilities by staffing, for example, you could also search by that. You can look at number of certified beds. So those are all different ways that you can look at this data. So let's sort this by highest rated facilities. We can see we have that here. And I'm just going to click into the first one on this list, just, no particular reason, just to kind of provide an example. So we can see that Stonehenge of Cedar City has a 5-star overall rating. And each facility, that overall rating is based on their rating on 3 different things below that. So we have a health inspection rating, a staffing rating, and a quality measures rating. You can also see when we click in, we have an address, a phone number, some kind of basic details about a facility. So within each of these ratings, we're able to click in and look at kind of what goes into that particular rating. So for health inspections, we can press view inspection reports, and then we'll be able to see a health inspection rating and the date of the most recent inspection and read their most recent inspection if we wanted to. So you can pop that open, see different items that they might have been cited for, a facility might have been cited for, and they have all of the most recent 3 years of complaint inspections and 3 years of infection control. So you can take a look at that. If we click out of that, we can also see some more details about a facility's staffing. So we can go in to view staffing ratings, and this has a lot of really helpful information, especially because a lot of experts agree that staffing is one of the highest predictors of quality in a facility. So here we can see the average number of residents in the facility per day and the total number of nurse staff hours per resident per day. What's helpful here is they give a national average, so we can see the national average is 3 hours and 54 minutes. Utah's average is 4 hours. This facility has 4 hours and 18 minutes, so can kind of compare both nationally and to Utah. We're also able to see breakdowns by registered nurse hours, LPNs, nurse aides. Some groups say it's important to pay particular attention to that nurse aide number because nurse aides do a lot of the direct care in a facility. We can see weekend number of nurse staff hours and also look at physical therapists. A little more details about RN staffing, and then we can also see staff turnover. So like this says, that's the percent of nursing staff or administrators that stop working a facility within a given year. So we can see that here total nurse staffing turnover is 43.8%. That is below Utah's average of 51.3% and the national average of 46.4%. So a lot of good information there. If we click out of staffing, we can also take a look at quality measures. And there's a lot of different metrics that they look at for quality measures. So you can see under short stay quality measures, there's things like the percentage of short stay residents who were rehospitalized after admission, the percentage of residents who got antipsychotic medication for the first time. And again, you can see on some of these the national average and the Utah average, flu and pneumonia prevention measures, and then additional quality measures for short stay residents. Then we can also look at long stay quality measures. So all of that just kind of gives you a picture of what's going on in a facility and what some of these particular metrics, how they're being rated on those. So if we close out of that and keep going down, there's other things that we can kind of glean from this. We can look at fire safety inspections and emergency preparedness, and kind of see those inspections, view those inspection details. Do they have automatic sprinklers? When was their last fire safety inspection? Have they had any citations related to fire safety and emergency preparedness? Those are important things to know. And then we can click specifically in to view their penalties. So if a nursing home has a serious citation or doesn't correct that citation, they may receive a penalty. And so we can see, how many federal fines have they had in the last year, what were the amounts of those fines and the dates, and if they've had any payment denials by Medicare recently. So that can be helpful. And then here, if we keep going down, we can see some more details just specific to the facility. Do they participate in Medicare and Medicaid, or just one or the other? How many certified beds do they have? Things like that. Then we can get into some of the details of a facility's ownership. So here we can see what is the legal business name. So this facility is owned by the Kane County Human Resource Special Service District. It says it's a for-profit corporation, so we can see ownership type here. And we can also look at, get a little bit more details about the ownership, who has operational and managerial control. If it's part of a chain, which we can see that this one is, we can see that, and we can check and see what is the performance of this particular chain. So is this part of a chain that's highly rated, or rated in a more, on the lower end of the scale? So if we go back, that kind of is a good overview of an individual nursing home, and that data is available for all of the state's nursing homes that we can check into. But one other thing just to look at really quickly, say you're between maybe two different nursing homes, there is a way that you can compare up to 3 different nursing homes. So here we'll just compare these top 3 because they're at the top of our list. If we press compare there, we're able to kind of quickly go through and see, what are the differences between these 3 facilities, their overall ratings, their health inspection ratings, some of those things that we were just going through earlier. We can see the number of certified beds they have, if they participate in Medicare or Medicaid, what their ownership type is. And so that can be helpful in kind of narrowing down if you're trying to make those decisions. And CMS stresses that this isn't necessarily a substitute for actually visiting a nursing home, and they recommend that you bring a list of questions, look out for things like people who aren't receiving the help that they need in a timely fashion, for odors, talk to some of the residents and their families and see how they are feeling about the care at that facility. But hopefully this is just a good tool that you can use as you embark on that journey to try and help narrow down that decision.